Okay, we are live on Facebook and recording here on Zoom. Thank you for joining us, everybody. This is Krista Gervon from Princeton Integrative Health, and I'm here with Dr. Vinny from Princeton Integrative Health as well. And this is kind of a combination of the Invincible Health series with Dr. Vin, as well as our Lyme Disease Awareness Month Health series. So we're combining the two to give you information today on how Lyme disease affects our brain and our cognitive health. So, Dr. Vinny, would you like to give us a brief overview about how Lyme affects our brain and cognitive health, please?
Sure. So Lyme disease, as most people I think may know, it's caused by a spirochete called Borrelia that gets into our system. Most people know that it causes, if you catch it early, it might cause an erythema migrans rash, but many people don't have that. Numbers are between 50 and 70% of people don't have the rash. But causes joint pains, causes fever, chilled sweats, that kind of thing in the beginning. But not everybody has that. But certainly if you have that, you would suspect Lyme. Usually in the early stages, the Lyme test will be negative. Mm-hmm. But then later on, if Lyme is either not treated adequately or is not diagnosed at all, the Lyme spirochete can get into our central nervous system.
Wow.
And if it does that, some people will have what's called the Bell's palsy, where one side of their face will droop. Certainly then most people would know to suspect Lyme. But sometimes that particular complication does not happen, and people just end up with chronic Lyme. Some people become severely ill with that and end up going to the hospital, get spinal taps and treated. But for other people, it can just cause a brain fog or anxiety, or depression, chronic fatigue syndrome, fibromyalgia, all things which, even though most people don't think of them as involving the nervous system, they often, those chronic diseases, the chronic fatigue, the fibromyalgia, actually are diseases that involve the nervous system. And for some people, Lyme is one of the causes of Alzheimer's dementia.
Wow.
So that's something that with our cognitive health program that, we check people for, to make sure they do not have Lyme disease.
Yeah, in our earlier event with Jenna, she talked about that, how so many people have this misconception about Lyme and how we detect it with the bullseye rash, and so many times that it doesn't appear that way. So people go undiagnosed for so long, and to your point, over time it can begin affecting our brain in that way. So I was even surprised to hear that, because I always knew that you look for the bullseye and that's the telltale sign of Lyme. So it's interesting to know that that's not always how it is.
Yep.
Yeah. So you talked about how it can even cause Alzheimer's. What does it do to the brain for the brain to begin cognitive decline?
Well, like any infection, it's associated with inflammation. Mm-hmm. It's associated with activation of the immune system. So the immune system is trying to keep it in check. If it finds infected cells, sometimes it'll kill those cells. But the spirochetes are pretty effective at evading the immune system, but usually knows something is going on. So there'll be a kind of a low level inflammation going on all the time. And for some people, that's enough to tip them over. They might have other risk factors, things like maybe their blood supply to their brain is not that great, or maybe they have diabetes and they have metabolic issues related to that. Yeah. So it might not be just one thing, but Lyme is certainly one of the ones that can do that. We're finding also, just on that same topic of infections that can contribute to dementia, people with oral health problems. Certain bacteria from the mouth have been found in the brain of Alzheimer's patients on
Right.
autopsy, of course.
Yeah.
Um, and so these chronic infection, I was never taught that in medical school. Of course, that was a few years ago for me. And that, you could get these kind of chronic infections that cause it. But if we look more towards like syphilis,
Hmm.
um, which is also caused by a spirochete,
Okay.
that can get into the brain and the central nervous system. There might not be any signs anyplace else, but over the course of decades, leads to a dementia also. So I think
Yeah.
it's the same kind of model.
Yeah. So if there's anyone watching and they are having these experiencing chronic illness, like you talked about, it would be something that they could come into our office, and then we would then begin to peel back the layers of the onion, really, because you said there could be other things going on. So we really try to get to those root causes with the testing, and then possibly a diagnosis if it's been untreated or been undiagnosed for so long.
Sure. And since you mentioned it, let me just mention a little bit about testing.
Yeah.
Testing for Lyme disease is not great.
Hmm.
You know, um, we Lyme disease is more of a clinical diagnosis with supportive testing, especially in the early stages, because when somebody has an erythema migrans rash, it's too early for the body to have mounted an adequate antibody response, so testing will be negative.
Okay.
But even later on, if somebody's been sick with Lyme for a long time, their immune system may be kind of beaten down enough
Right.
that it doesn't, the antibody testing is still negative. And so it's not uncommon that people who might have what appear to be all the clinical symptoms of Lyme might have a negative test, but once you start to treat them
Right.
and the immune system starts to recover, then all of a sudden they're positive.
Oh, wow. So interesting.
So, you have to be careful. I have a lot of people come in and say, "Oh yeah, I had a negative Lyme test," and I'm like, "Yeah, but we'll see," you know. Because there are certain labs that are better at that kind of testing than other labs. Um, so if somebody goes to LabCorp Request and they have a positive Lyme test, we trust that. But if they have a negative Lyme test there,
Yeah.
that's something that's open to question, and we will do further testing for them.
Yeah, we touched on that a little bit too with my talk with Jenna, just how they're not very sensitive to it. So you may get a negative test, but like you said, you got to really dig in there and see what could be happening.
Yep.
I'm going to go check on Facebook to see if we have any questions, but feel free to give any other information about Lyme, brain health, anything like that, and I will go see if we have any questions.
Okay.
No questions on Facebook, but if anyone on Zoom wants to put anything in the chat, we're here to answer any questions you might have. You can always call our office and schedule a discovery session if you have lots of questions and you want to get them answered. The number to call is 609-512-1468, or you can email us at info@princetonih.com. The discovery sessions are about 30 minutes long, so you get plenty of time to talk about any challenges you might be going through. And the Lyme Disease Awareness Month Health Series, it's a mouthful, continues next week. I'll be speaking with our acupuncturist, Joe Bonacci, about how functional medicine how a functional medicine approach to treating Lyme can really help with the symptoms that you might be experiencing. So we'll be talking on Wednesday, May 26th at 12 p.m. noon, and you can join us here on Zoom or on Facebook Live. But yeah, if there's any other information you wanted to share with anyone, please go ahead.
Yeah, I mean, Lyme affects all age groups.
Mm-hmm.
Our kids can have it, and studies show that 40% of them don't have a recognized erythema migrans rash, so you have to be careful of that. Make sure you're checking children for ticks. Make sure you're checking your pets for ticks, because they can get Lyme, or they can bring Lyme into you. So it's very important to do that. Some people will have their yard sprayed. To try to keep the ticks down, try to do that with as natural ingredients as you can, so you don't poison yourself while you're doing that.
Yes.
But for pets, you could put the tick collars on them and that kind of thing. Do the tick treatments. So that's another important thing to do. We have kind of a natural essential oil spray that's tick repellent. So if people wanted any of that, they're not just getting the typical chemicals that you can buy at the pharmacies or home goods stores and that kind of thing. So yeah. And it's not just, of course, it's not just Lyme, but there are other co-infections, things like Bartonella, common co-infection that also affects the brain. Very commonly, maybe even more so than Lyme, causes things like anxiety, depression, personality changes, especially in children. So if there's anything like that going on, something that just seems so out of the ordinary for somebody, then I would say, probably best to find a Lyme literate physician and have some testing done to see if that could be what's going on.
Great, yeah. Did anyone have any questions on the Zoom here? Susan, did you have any questions?
Hi. Well, it's not really a question, but I'm in England, as you probably know. It's not really taken seriously here. I did go to the doctor a few years ago, just and said I thought, I might have it, and I was just treated like a nutcase, basically. There's no awareness of it in Britain. There is in Germany, and I'm not sure about other countries, but they're very aware of it in Germany, but not here.
No. In the United States, there is certainly a big divide in physicians who believe in Lyme, chronic Lyme, that kind of thing, versus other doctors who say those things don't exist. So there's kind of almost a raging debate in the medical community here. So people here in the States have to find a doctor whose philosophy includes that. Otherwise, as you said, you kind of treated like a nutcase, and
or a hypochondriac, I suppose, is the right.
So how'd you get hooked up with us here in this program?
I don't really know. I'm not sure. I think it came through on Eventbrite.
Okay.
Yeah.
Oh, good. It's nice to hear. Nice to hear it's getting out there that way. So super.
But I don't know if you've been to any conferences in England or in Europe.
No, I haven't been.
No. I mean, they probably don't have any, because I don't know I mean, they wouldn't have them here, but they might have them in mainland Europe.
Yeah,
as I said, they definitely take it seriously. And I mean, I know people in Germany whose someone whose child got it. So they do. There's no awareness of it at all in England, none whatsoever.
Wow.
Or the whole United Kingdom, So it's strange, isn't it? Does it cover? Is it prevalent throughout the whole of the USA, or is it more prevalent in certain states?
Well, I think it's spread all over the U.S. now, but it's certainly more prevalent in some states. That whole, the Connecticut and the northeast of the U.S. certainly has a lot, but it's really been spreading everywhere now. But I was going to say I went to an integrative medical conference, and there was a company from Germany that specialized in Lyme testing. So I'm not surprised that that they that would indicate to me that somebody there in Germany was taking it pretty seriously.
Absolutely,
So,
And I
Yeah.
mean, if in the States you were being you were presenting with dementia, or would you automatically be tested for Lyme?
Depends on who you go to.
Mm.
There's a physician who wrote a book called The End of Alzheimer's. His name is Dale Bredesen, MD, and he's been studying Alzheimer's for like 20, 30 years now. And he's actually put together a program where he prevents and has said that in about 100 people, he has helped reverse cognitive decline, improving their cognitive scores on standardized testing and that kind of thing, and in real life kind of ways. And so he teaches other physicians, certifies other physicians to do that. And part of his philosophy is that you have to test people for Lyme.
Mhm.
Yeah, yeah.
If you don't have
Absolutely.
other explanations and they're not getting better with the, I think I mentioned some of the things. If they have diabetes and you treat their diabetes and that's getting better, but they're not getting better, then you better start looking at things like Lyme disease and maybe heavy metal toxins and that kind of thing. So, but there aren't many physicians that are doing that in the U.S. We're a very small
So
minority.
you're integrative
Right.
health,
Mhm.
and so you're not mainstream, I guess.
You could,
mean,
right. I am,
mm,
I was, for 32 years, I was doing conventional mainstream medicine. Both I've worked in an ER and then family medicine, which is where my training is. And then I have branched out into, more of the looking deeper for the root causes of illnesses and using more holistic means. I'll use
yeah,
conventional antibiotics and whatever when I need to, but much
yes.
more nowadays looking to botanicals, herbals, that kind of thing to help people. And those things are also effective for Lyme. There are botanicals that we use for that. I use some antibiotics for people, but also I try to get them onto botanicals as quickly as possible too.
That's really interesting. I mean, we used to call it alternative medicine here, and now we call
It's
it.
still called that here.
Yeah.
But we do call it integrative medicine now. And
Yeah, good.
I live in Bristol, and there's this place called the National Centre for Integrative Medicine here,
Mm,
which I'm sort of a member. I go on their webinars and things. But we have the National Health Service.
sure.
We used to have we had a homeopathic hospital here in Bristol on the
Wow.
National Health Service.
Oh, that's great.
I mean, the hospital was kind of taken away, and they had a little sort of hut at the side, and then the university took over the hospital, which was a beautiful building, is a beautiful building, for their student health centre.
Mm.
And then about 2 or 3 years ago, the NHS just withdrew the funding.
Wow.
Oh,
And that's
geez.
when the National Centre for Integrative Medicine was set up. But you have to pay. I mean, we're not used to paying, but you have to pay for integrative medicine.
Mm,
And that's what, when I said, it's not taken seriously, I mean, if you go to a general practitioner,
sure.
an NHS GP, you won't really get very far.
Yeah. Well, it's the same here. That's the same in the States. You have to find
Yeah,
some
that's
type of,
very interesting. Yeah,
yeah.
but
Uh,
it's great that we. I mean, it's great that we've got the National Centre for Integrative Medicine here.
yeah, that is
Um,
wonderful.
But because they took away the NHS funding, it's actually quite expensive. So.
Sure. Well, same
But
thing happens here. We're on an, most of the US is on an insurance model, but we
yes,
found
yes,
that we could not, in integrative medicine, we found we could not survive within that model. So we are
no,
outside of it.
I understand that totally. Yes.
Yeah. So
Well, it's very nice to Yeah.
Nice to meet you, Susan Milestone.
Very nice to meet both of you.
And we always do these types of events, so you can continue to check back on Eventbrite and join us for future events like this. So we cover all types of different topics, so we welcome you to tell your friends as well.
I will. I've got a friend who's definitely interested in Lyme disease, so I'll try and get her.
Yeah.
Thank you so much. Thank you very much. It's been great.
You take care. Okay, thank you. Bye-bye.
Bye.
Well, that was a great chat. Thank you so much, Dr. Vinny, for all that great information. And thank you, Susan, for joining us. And thank you, everyone else, for watching. And we will see you next week, same time, 4:30. And again, I'll be with Joe Bonacci on Wednesday at noon on May 26th, talking Lyme again. So thanks again, everyone. Have a great night.
Bye, Krista.
Vinny.